Good day everyone. In today's video we will be discussing postural drainage, or sometimes it is also called as bronchial drainage, and it means the mobilizing of the secretions from one or the more lung segments to the central airways by placing the patient in various positions so that the gravity assists in the drainage process. So in last video we have discussed about the bronchopulmonary segments. So in both lungs we have 10 bronchopulmonary segments in each lung, and postural drainage is that when we position the patient in such a way that the gravity assists the drainage process and from that segment to the central airways. So it also postural drainage is the positioning only, but we have to accompany along with the manual techniques such as percussion, shaking, vibration, and voluntary coughing. So when secretions are moved to the larger airways, then they are cleared by coughing, or if the patient is in ICU and a suctioning tube can be used. So endotracheal suctioning can be done. Now positions, they are based on the anatomy of the lungs and the tracheobronchial tree. Patient must be positioned on the postural drainage table that can be elevated at one end, that is tilt table, or if a small child has to be treated, so we can position on physio's lab. So this is a tilt table which can be used for postural drainage. Main goals of performing the postural drainage is to prevent accumulation of secretions in patients who are at risk for pulmonary complications. This may include the patients with pulmonary diseases that are associated with increased production of or viscosity of the mucus, such as chronic bronchitis, cystic fibrosis, and the patients who are on prolonged bed rest. Also for post-surgical patients who have received general anesthesia and who may have painful incisions that restrict the deep breathing and coughing post-operatively. And any patient who is on the ventilator if they are stable enough to tolerate the treatment. So to remove the secretions already accumulated in the lungs of patients with acute or chronic lung disease like pneumonia, atelectasis, acute lung infections, and chronic obstructive pulmonary disease. Patients who are generally very weak and very elderly, they can also be given. Indications: cystic fibrosis, bronchiectasis, atelectasis, lung abscess, pneumonia, acute lung disease, COPD, and the patients with high spinal cord lesion and after thoracic or abdominal surgery patients. We can also give it to the patients who have received general anesthesia, have a painful incision, and the patient who is on ventilator. Basic contraindications is increased intracranial pressure, unstable head or neck injury, any active hemorrhage, hemoptysis, that is blood in the sputum, recent spinal injury, empyema, bronchopleural fistula, flail chest, uncontrolled hypertension, any rib or vertebral fractures, and tuberculosis. So in all these conditions, the postural drainage is totally contraindicated. Also in pulmonary embolism and sometimes aged, confused, or anxious patients who do not tolerate the position changes. So these are the basic preparation that you have to just loosen the clothing. Sputum cup should be there, pillows, and we have to explain the treatment and teach the patient the deep breathing and coughing beforehand. So determine which segments are involved, note down the vital signs, decide which position of the patient you have to give according to the segment involved. Then maintain that position, apply manual techniques, and at last do cuffing or suctioning to get rid of the sputum. So next is the manual techniques. First is percussion. Percussion is used to mobilize the secretions by mechanically dislodging the viscous and adherent mucus from the lungs, and it is done by the cupped hand over the lung segments being drained. So here the physiotherapist's cupped hand alternatively strikes the patient's chest wall in a rhythmic fashion to help loosen the thick secretions. And the patient should try to keep his shoulder, elbow and wrist loose and mobile during the maneuver. And this procedure should not be painful. So this is the position of the correct hand position for chest percussion. So to prevent any irritation, patient can wear a light gown or shirt, or you can place a towel over the area where you are performing the percussion. The contraindication to percussion is over any fractures, if the osteoporotic bones are there, spinal fusion, over any tumor area, if there are chances of pulmonary embolus, and condition in which hemorrhage could easily occur, like if the patient is on anticoagulant therapy or there is low platelet count, and patient with unstable angina, or in case of chest wall pain like after surgery, coronary artery bypass grafting or trauma. Next technique is vibration. So this is done in conjunction with percussion, and it is applied only during expiration. So it is applied by placing both hands directly over the chest wall or one hand on top of the other and gently compressing. So the therapist stiffens his arms and shoulders and apply light pressure and rapidly vibrating the chest wall as the patient breathes out. So the vibrating action is achieved by the physiotherapist isometrically contracting the muscles of the upper extremity from shoulder to hands. So we ask the patient to breathe in deeply and exhale slowly and completely. Taking a deep breath and then exhaling slowly and forcefully without straining will hopefully stimulate a productive cough. So this is a correct position for vibration. Next manual technique is shaking. So it is a more vigorous form of vibration which is applied during exhalation using an intermittent bouncing maneuver which is coupled with wide movements of the physiotherapist's hand. So the therapist's thumbs are locked together, the open hands are placed directly over the patient's chest, and the fingers are wrapped around the chest wall. So the patient simultaneously compress and shake the chest wall. So these are the basic techniques.